Well, good morning, everyone. Happy Valentine's Day, almost. We hope you're having a great start to 2024, and we want to welcome you to Trio Maryland's February Zoom meeting. It's great to see everyone. I'm Marty Marin, and this is my wife, Michelle, and we manage Trio Maryland. We'd like to welcome all our members and guests this morning, and thank you for all attending. Today's topic, introducing you to Anatomy Gives Registry, where you will learn a very useful information about end-of-life decisions. Next month, March, which is National Kidney Month, our friends from MKF will be here to be presenting. Look for the meeting email this week for the additional information about that meeting. Now, Michelle will introduce our speaker.
Good morning. Today's guest speaker is Erin Silvers. Erin is with Anatomy Gifts Registry, or AGR, as a donor services coordinator and has been for 3 years. She has worked as a nursing assistant for elder care and for hospice care for many years prior. Erin wants to thank everyone for their time and interest, and today she will be discussing whole body donation through AGR and what that process looks like with their program. Erin will go over a brief presentation and will be available for your questions afterwards. We're very fortunate to have Erin Silvers here today to address our Trio Maryland community. Thank you, Erin, for presenting to our group. Welcome, and I now turn the program over to you.
Thank you, Marty. Thank you, Michelle. So good morning, everyone. My name is Erin Silvers, and I'm a donor services and family coordinator with Anatomy Gifts Registry. Today, I'm going to introduce Anatomy Gifts Registry and share some information about whole body donation. I'm going to discuss how to refer patients or families to our services or get registered if you might be interested as well. So Anatomy Gifts Registry is a nonprofit whole body donation program that exists to support advancements in scientific research and medical education. We've been around since 1994, and we are proudly formally recognized as a 501c3 nonprofit since 1996. We have our own crematory on site, which means everything from the donation process to the cremation is done here in-house at Anatomy Gifts. We voluntarily sought oversight from one of the few states in the U.S. that offer a tissue banking license. So we're certified as a tissue bank through the state of New York. And then we also sought and achieved further oversight through the accreditation by the American Association of Tissue Banking, or AATB. Most of the management staff at Anatomy Gifts are AATB certified tissue banking specialists. And at this time, we have over 20,000 pre-registered donors that are pre-registered for when that time comes to donate their bodies to science. So what is whole body donation? Whole body donation, otherwise known as anatomical donation, is the donation of a whole body after death for the purpose of advancing medical research and education. It is a no-cost alternative to traditional arrangements that still allows for the return of cremated remains. So just want to kind of touch on the differences between organ donation and body donation because the two are often confused. So with the heart on your license, that means that you have consented to organ or tissue donation. That does not automatically enroll you for body donation. That would be a separate process you do with a program directly. Organs and tissue donation is when organs or tissues are recovered and transplanted into another living human for life-saving or life-enhancing procedures, such as heart transplants, kidney transplants, skin grafts, and things along those lines. And then whole body donation is when a deceased person's body is utilized for medical research and education, such as cadavers for medical schools, joint replacement repair techniques, surgical training, orthopedics, prosthetics, and things along those lines. Every donor that goes through our program is able to benefit approximately from 4 to 7 different research or education studies. So just one donor has the ability to impact immeasurable lives. Surgeons must first learn how to harvest blood vessels for bypass grafts. Oncologists must first learn how to research less invasive procedures for tumor resection and so on. So donors that go through our program really do make a difference in advancing medicine and education as a whole. And then some of the research endeavors that we do place tissue for with donors that go through our program would be the development of new techniques for organ or tissue recovery and transplantation. So our local organ transplant organization will come into our facility for training, and they will practice, their recovery techniques as well as new techniques that they're discovering on how to efficiently recover tissue and organs in a timely manner, so that way they can be transplanted or used to enhance someone else's life. Biomechanical studies, hearing and vision impairment studies, psychiatric disorders, life-saving in the field procedures. So EMS and paramedics, they come into our facility and also use donors for, EMS training for in the field and real life situations. And then the question would be posed is, why would somebody choose whole body donation? So patients or their families have a lot of different motivating factors when it comes to choosing body donation for disposition. Many choose this option for financial availability. There is no cost for whole body donation, unlike traditional funeral or cremation arrangements. So some folks just simply don't have the means to pay for a traditional burial or funeral. And then while others may indeed have the ability to do so, but they see it as an unnecessary cost when this option exists or other options exist. We also have families or donors that donate because they're very interested in educational advancement. So they have the desire to pay forward or show appreciation for the training or education they experienced themselves or that their children benefited from. I've discussed with a lot of donors or families that, they have a doctor in the family or a nurse, and, they want to be able to give back and provide somebody else the opportunity that their loved one was given when they were in medical school or going through their medical training by, the research and education they did with their cadaver labs and things along those lines. So just kind of paying it forward and allowing somebody else to have that experience. And then we also have others that just see donation as simply the practical thing to do. Essentially, if they can donate their body to help someone or help advance research and education, they would like to do so. And then just some things I would like to highlight on when it comes to donation through Anatomy Gifts Registry and how we differ from other programs. So we are accredited by the American Association of Tissue Bank, and we are a nonprofit. There are several whole body donation programs across the country, and many of them are for profit. We believe that body donation programs should be nonprofit to ensure the utmost respect of the donor. While for-profit organizations can certainly be altruistic and accountable, these attributes can be compromised by the need to generate profits for owners, investors, or shareholders. Out of the 7 body donation programs that are AATB accredited, only 3 of those, including Anatomy Gifts Registry, are nonprofit. In addition to pre-registration by oneself, we do allow for next of kin donations. So we are one of the few programs that allow for your family to donate after death without you pre-registering yourself or being registered prior. And then according to the Uniform Anatomical Gift Act, that sets the regulatory framework for donations of human tissue. And that kind of outlines the rules and regulations on who's able to donate a loved one after death. With Anatomy Gifts Registry, our donation program, we are able to return partial cremated remains. So whatever tissue is not utilized for the donation of research and education, that we would individually cremate and return if so requested. Some programs can take up to 2 years to return cremated remains, but with our program, with it being partial remains, we are able to have the ashes returned in about 6 weeks. We accept most donors in most states. So if someone is registered, in Maryland, but then they move to Florida, that doesn't negate their donation with our program. We do work nationwide, and we do have a very wide service area. So if you were to move from wherever you registered with us initially, that doesn't negate you from being donated. And we do our best to try to ensure that we can accept our pre-registered donors. And then previously mentioned, a family can request a specific area of research and education. So we have families that go through our program that are interested in dementia education and research, or cancer placements for research and education. So with our program, we are able to accommodate for special requests. Our medical director exhausts all efforts and options in trying to meet those requests. It's not always a guarantee, but that is one thing that our program is able to do that others may not. Because we want to improve knowledge and the healthcare outcomes is a global and shared effort. AGR is able to place donor tissue with research and education, both domestically and internationally. So our donors don't only benefit research and education here in the United States, but they're also able to benefit research and education worldwide. And then finally, one thing that our program offers that I'm not too sure many others do is we offer an optional follow-up letter. That letter is sent out a few months after the donation has concluded, and that actually allows your family to read about the specific research and education avenues that your donation specifically benefited towards. So that would allow them to read how your donation benefited and advanced research and education by going through our program. And then just a few things, just kind of discussing how we work and how we operate. Anatomy Gifts Registry places the utmost importance on services provided to our donor families. And one of the most important characteristics here is our caring staff. We have a coordinator on call and available 24 hours a day, 7 days a week. And we're always happy to help families in whatever way we can before, during, or after the donation. We're all very well versed in handling sensitive situations with compassion and understanding. And we often get, gratitude from families who express, that we were able to provide, such kindness and ease in a very otherwise difficult time for them. And then as previously mentioned, with the special requests from families, we can also allow for a return of thumbprints to be made into jewelry, a lock of hair, and then, for families that may be local to our facility for pickup, we can even do an urn transfer or put ashes into jewelry. So we are able to accommodate on a multitude of different levels of being able to have your family have something to remember you by thumbprints, a lock of hair, or we can even, put some ashes into jewelry if that's something that they would be interested in. And then just to kind of discuss, the cremated remains. So when donating with our program, the donor or their family has the option to donate with or without the return of cremated remains. The cremation takes place at AGR's facility. We do not outsource for cremation, so we are in control of the entire process. Cremated remains are that of an individual. They are not multiple donors. So any tissue that's not utilized for a specific donation, that would be individually cremated, processed, and then returned in 6 weeks to your loved one. So it would only be, one specific donor that's cremated at a time. We don't do mass cremations for return. And then with our program, it is partial cremated remains. So whatever tissue we don't, again, recover for research and education, that is what we would be individually cremating and returned. It's returned in about 6 weeks, and it equates typically to about 1 to 2 cups of ashes. But with it being partial remains, this allows AGR to optimize the gift, meaning the donor can impact many areas for research and education, but it also allows for us to provide timely closure for families and loved ones. And then any family that is local to our facility, we are located in Hanover, Maryland. They have the option to pick up the ashes, or we can ship nationwide. There is a $35 shipping and handling fee we ask for the families to cover, but we don't withhold ashes for non-payment. So when they're ready at 6 weeks, we send them regardless. And then we have a very thorough process to ensure, that the ashes are returned. They are tracked on our end through United States Postal Service certified mail, and they typically arrive within about 2 business days. But we do track the package on our end to make sure that it meets its destination, and we keep the families informed throughout the entire process of the shipping on when they should expect to arrive. Or becoming a donor is easy, though nuanced. So if you are interested in, whole body donation or getting registered with our program, you can call us anytime at our toll-free number, which will be 800-300-5433. There's just a few pre-screening questions to ask and that we would go over. And then we would kind of differentiate on the 2 different types of registration we have. So if you're, fairly healthy and planning for the future, we would mail you a registration packet to complete and mail back in. And then if it falls under the category where, you're terminally ill, imminent, or expected to pass, we would then expedite your registration. We would try to get you your forms via email or fax. So that way we can get you registered within a day or so of speaking with you. So everything's done, and it's one less thing that you would have to worry about. But then we also have situations where if a family contacts us and their loved one is no longer lucid, competent, or able to sign their own consent forms due to dementia or because they're at end of life, the family is able to pre-register the donor, meaning they can do the application ahead of time and kind of get a bulk of the paperwork out of the way. And then when the passing occurs, all they would need to do is just complete the actual authorization for donation. That's very quick, simple, and we do it through email via DocuSign. And then when that time comes, we get the person picked up from wherever they pass away within about an hour and a half to 2 hours. So you don't need to have pre-arrangements with a funeral home. We handle everything for the transportation, the donation, and the cremation, and there is no cost associated whatsoever. Touch base that registration can be helpful, but it's certainly not required. We do take at-need donations, at all times. So God forbid, if there's ever a situation and you're needing our services, just give us a call. Whether the person's registered or not, we'll still do whatever we can to help you out in that moment. If anybody has any questions, I am more than happy to answer them. I think there's a few in the chat, but I just want to thank everybody for your time and, jumping on today to listen to the presentation.
Thank you, Erin. There was a request that you repeat the phone number. Maybe you can put it in the chat feature too.
Yeah, yep, I can definitely do that. And I'll say it again. So the phone number is 800-300-5433. And we are available 24 hours a day, 7 days a week. Hurricanes, tornadoes, holidays, we're always here.
And there was a question earlier about hydrolysis. Is it available as an alternative to cremation?
So at this time, it is not an option for our program for return of cremated remains. It's incineration cremation, which is how we dispose of, just bio waste, and is how we do our cremations. I know that hydrolysis is becoming more talked about, and I know that our medical directors, they're looking into other alternatives, but at this current moment, it is cremation by incineration, and that's how we would return the ashes.
I don't mean to be the dumb one in the group, but I don't really know what hydrolysis is.
So it's water cremation, essentially. So instead of cremation, via, heat, it's essentially a cremation by water. It's newer. I actually did a presentation last year in New Jersey about end of life planning, and that was one of the things I had to research. So it's essentially a cremation, but instead of with heat, with water.
Thank you.
And then you had a question, what are the circumstances that result in partial donation?
Um, could you clarify just I'm just not too sure what that question means.
Well, okay. So this is Rich. I submitted the
Yeah.
question.
Uh-huh.
When you were talking about cremation and returning a part of the
Uh-huh.
donor, and
Sure.
so that's really when I was talking about partial donation, it was related to your discussion there about releasing uh,
The ashes and
the
things.
cremated
Yeah.
donor.
So when a donor comes through our program, how it works is we do a mandatory blood test, and then, that looks for any evidence or treatment for hepatitis B, hepatitis C, HIV, and syphilis. Once that blood test comes back and everything's clear, we then do an evaluation on what tissue would be usable and placeable for research and education. At that point, we would then recover the tissue that we're going to utilize for research, and then any tissue that we don't utilize to place with education and research, that tissue we don't use is what we would be individually cremating, processing, and returning in 6 weeks. So whatever tissue we're not using for the actual donation, that is what would be individually cremated. Does that make sense?
Yes, it does.
Okay.
And then I'm just curious from the research side of things, at what point do they say, okay, we can no longer use this tissue?
Sure. So with donation, and this is actually included in the consent forms, there is no clear timeline on when the researchers or educators will be, done with their research or education, or when they're no longer needing the tissue. So any tissue that is placed for research and education, once it is, utilized and once it is returned, that is just mass incinerated as bio waste.
Mhm.
So any tissue we do place, we would not be able to individually cremate and send back. So whatever tissue we don't use and cremate, that's all that's typically returned. Any usable tissue is just incinerated as medical waste once it is returned, or the end user or researcher, if they have the facilities or the ability to do so, we do allow certain researchers and educators to mass incinerate for their medical waste as well.
I see.
Mhm.
And I'm just curious, like, how are I'm just trying to get a sense of how the majority of the donors' body parts are used. Is it organs? Is it skin tissue? Is it whole body that
Yes,
is
so
actually?
the best way to describe it would be to imagine the whole body being donated.
Mhm.
And, as simple as, your leg could be used to help orthopedic surgeons practice knee replacement techniques or practice a new ankle replacement repair technique. And then, you may be able to assist EMS training with intubations, or, in the field, real life traumatic situations that they're trying to get, surgical training on. And then, any tissue that we don't utilize outside of that is what we would individually cremate. But each donor is different on how they
Yep.
can, benefit and utilize research.
Right.
And the only way for us to really know what would be beneficial per donor is once they arrive into our care, we kind of map out what research and education is looking for at that time, what clients are requesting tissue. And then we just kind of go from there on, what would be usable and placeable for your donation, versus what would be usable or placeable for my donation, if that makes sense.
Yes. All right. Thank you.
No, that's okay. There were a few other questions. So heart and liver transplant recipients, yes, you can be a whole body donor. Any transplant recipient, regardless of what was transplanted, that does not exclude you for donation. We do accept transplant recipients as whole body donors. And then what are the requirements to donate? So you would just need to give us a call. There's a few pre-screening questions that we would go over. And then we would send you a registration packet. It's about 30 questions of your medical and social history, some information for what would get printed on your death certificate, because we will ensure that your death certificate gets filed with the information that you provide when you complete the packet. And then there will also be your consent forms that's actually authorizing you to donate yourself to science, to our program. And then on those forms is where you would make your election about if you wanted ashes returned returned and things like that. So you would just give us a call and we would send you a registration packet. Now, if you're considered imminent, terminally ill, or expected to pass, we do expedite those registrations because we want to get, you registered as soon as possible in the event that you happen to pass away. Um, How long will a hospital PA resident already signed up? So in Pennsylvania, and every state is different when it comes to like their timeouts, when it comes to people that pass in hospitals. Pennsylvania, I think they have like a week timeout. But as long as we're contacted at time of death or, shortly after, we can typically get the donor picked up, within about a day or so from the passing. We do like to get medical records, just to ensure that there wasn't a significant trauma or blood loss when somebody's in a hospital setting. But, if you happen to pass in a hospital and we're contacted within, a day or so of the death, I'd say we can get the donor picked up within about a day or two. And Pennsylvania is pretty flexible with their holding, and we're in contact with the hospital throughout the entire process when somebody passes away. So, they're well informed on where we're at in our process when we're accepting or when we're getting transport arranged. And we're also pretty good with communicating throughout the family with that entire process as well. Is the research done locally and or nationally? I have a rare bone condition that I would like to be specified. Okay. So, with the placements for research and education, we do place donors both internationally and domestically. So if you are interested in being donated towards a specific type of research and education, I would say give us a call. Now would be the best time for us to kind of put those feelers out there. Our medical director can start making some calls, reaching out to some programs to see if there is an area for research and education for whatever condition you wanted to be donated towards. I do have to, clarify that it's not a specific guarantee, so I can't guarantee we would meet that research or education avenue, but we will exhaust all efforts. And we've had donations where somebody wanted a research and education placement, they registered with us when they were healthy. We didn't have any. They became imminent and terminally ill, or they passed away. And then, we actually were able to find a research or education placement that had recently become available. So even if we can't find something right now, that doesn't mean that something can't open up in the future and that we couldn't place you. It's just not a guarantee, but we do exhaust all efforts. Is the donation made immediately upon death, or is there time for a funeral at the time of death? So, with donation, it is time sensitive. Unfortunately, it's very rare that you would be able to have, an actual funeral type, memorial. The reason being is because our donors aren't embalmed or preserved in any way. If somebody is embalmed, that would unfortunately negate them from donation. So with our program, we would need to be contacted as soon as possible. The donors are held in refrigeration to kind of preserve the donation. And then the donor is brought to our facility, and then we, take care of the tissue recovery within, a day or so of the donor arriving. So unfortunately, there isn't the option for traditional viewing. But your family is able to do a memorial or a celebration of life. They can do that with the ashes in 6 weeks when they're returned, or they can do that in the interim. There are some specific instances where, a family wants to see a donor and our funeral home partner is able to, allow for like a brief viewing where the family can come in. It's like, a 10 to 15-minute thing. Those are very rare, but they can be accommodated. It just wouldn't be a typical, you're laid out and viewed, for a few hours, because there is no preservation available when you're going to be donated. And then, would the whole body donor have to inform the life insurance company? So actually, your family would just need to call the life insurance company and let them know that your passing has occurred. And then they reach out to our program. I get these calls quite often, and we just confirm, that the person was donated through our program. We confirm, that they did pass away and what date. And then that's typically sufficient enough for them to be able to pay out the life insurance. So your family would just let them know that you've passed away, refer them to our company for confirmation. And then we would just do that verbally or fax them something if they need it. And then Patty had a question about for donating organs. So organ donation is really only applicable if you pass away in a hospital setting. So if you passed away at home under hospice care, in a nursing facility, anywhere outside of a hospital, donation for organs or tissues typically doesn't occur because they have a very strict and stringent time frame and window, and when they have to do things, when the tissues have to be recovered. So if you don't pass in a hospital setting, it's very unlikely organ donation is actually able to occur. And not a lot of people know that, so I thought that that might be helpful to put out there. But if you do pass in a hospital setting, you are a candidate for organ or tissue donation with your local transplant agency. How it would work is we would allow them to recover whatever tissues are usable or placeable for their type of, transplant. And then once they're done, we would then take the whole body for, research and education. We work with shared donors all the time. So we work with multiple organ donation organizations throughout the country for us to be able to accommodate both an organ donation with their program and then the whole body donation through ours. So we would essentially just kind of figure out, what you're a candidate for with their program, allow them to recover. And then once they're done, they contact us. And then we would make the arrangements to get, the whole body picked up and then brought into our care for the research and education of the donation.
Now, Erin, Yvonne has had her hand up for a while, so I think she has.
Oh, I'm so sorry. I didn't even see that.
Good morning, and thank you very much.
Good morning.
What I'd like to know is, I am involved with groups that have conventions, and we have a large setting of people. Are we able to get information to introduce this to that type of group? Because this is my first time hearing of this. And I think if more people knew of this, they may be more willing to participate. So can you get information? Can you do a speaking engagement like you're doing here with large groups?
Yeah, I can. I don't know if I can put my email in the group chat if you want to email me directly. And then we can kind of discuss, where you're located. Where are you located, by the way?
I'm in Washington, D.C.
In DC? Oh yeah, that's perfectly fine. I'm in Maryland, so
Yeah.
Close proximity. But yeah, I can send you my email address, and then we can kind of discuss and figure out what the best way would be. But yeah, I do in-person, presentations or in-services and stuff like that all the time to, advance the knowledge and get body donation out there. So I can definitely accommodate that. That wouldn't be an issue.
And also, do you have flyers that we could, like if we're having a convention and we're passing out material, can we pass information out that way?
Yeah, exactly. When you email me, I can send you kind of like a marketing box almost that'll
Yes,
have like
yes,
brochures, flyers,
yes,
pens. Yeah, I can
yes.
send you all of that stuff. And then, I can also hand out stuff like that too when I do like my presentation or whatever you need me to do or want me to do.
Oh,
I'm more
thank
than
you.
happy
That's
to do
what
that.
thank
Yeah.
you very much.
So Yvonne, anytime someone poaches one of our speakers, there is a fee involved. So
Not a problem.
we'll get back with you and let you know about that,
That
okay?
is the groups that I am involved with. That is not a problem.
I'm just teasing you. Very
Okay,
good.
thank you.
I'm glad you're going to get the information you want. That's perfect.
Thank you very much.
Oh, you're
And just to answer your question, Milton, yes, I can do virtual presentations. I can do Zoom meetings. Anybody that's interested in, wanting me to present or speak or just try to get more information out there about body donation, I'm more than happy to do that. We can schedule something and I can provide the presentation, handouts, flyers, whatever you guys are interested in, I'm more than happy to accommodate.
That's great. It sounds like you really hit the jackpot here with people. This is a little known situation, I think, for a lot of people. So I think this was an excellent topic, and I think you provided a lot of information. The slide deck that Erin presented is already on our website. So if you wanted to see those couple beginning slides, you can go to triomaryland.org and you'll be able to access that through speaker notes. And of course, you will get the recording of this in about a week.
Sorry again, the presentation didn't work in the beginning. I didn't see the message, but yes, Michelle does have the entire presentation, but I am open to any questions. And if you have any questions, don't hesitate to send me an email. But I'm going to retype my email because I did send it wrong in the first place.
It's hard to talk and type at the same time. I find that myself all the time. But this is really, the other thing is, Marty and I and another one of our members, we had taken a tour with Erin at Anatomy Gifts Registry. And I think with planning and of course letting them know, I think they welcome people to also visit their location here in Maryland. So that's an option for local people if there's more information, if you just want to kind of get a handle on what they do and what it looks like. So you're getting a lot of great presentation, great information and all that in the chats. And I see you said you're welcome, everyone.
Well, we want to thank everyone for attending today. We love seeing your smiling faces. We want to remind you to check out our events on our website for advance notices of future meetings. And we'd like you to check out our website at www.triomaryland.org. All of our past meetings have been posted to our YouTube channel for your convenience. And we want to thank you so much, and we'll see you next month. And for those who wanted to send me a Valentine's Day present, like a box of chocolates, please just go to the Trio website. You will see our mailing address there. There is no minimum. We will take any size presents, all the way up to the truckloads. But in all seriousness, we want to thank everyone for attending today, and we wish you all a very nice Valentine's Day.
Yeah, super.
Thank you guys again.